Before we start, I just wanted to share briefly that a good part of this, the role play, is actually a true story, because approximately 4 years ago, I did face a pretty immense obesity issue, to the tune of 122 pounds. So not all of this is role play, so the content of what you're going to hear is actually true content that actually took place in my life.
I wish I would have done it. Dan, how are you today?
Good, thank you.
It's good to see you again.
Thanks, Sergeant.
I know that you came here for your stomach and it's been bothering you lately.
Absolutely.
And when you came earlier and filled out a health screening form, you mentioned that there were some areas of concern: smoking, drinking, and weight. Are there any of these areas that you'd be willing to talk to me about today?
I'd like to talk to you about my weight. It's really created some issues in my life.
What is it that concerns you about weight?
Well, there's some other things going on with me that I'm not sure whether they're related or not. I've been battling chronic gastritis now for about 10 years, to the point where I take 300 milligrams a day of Zantac. I buy it over the counter. It's pretty expensive. I'm out of breath. My blood pressure is always on the high side when I have it taken, like 150 over 90s. It's just I'm really concerned. I'm over 50 years old and I'm a candidate, for a heart attack.
Do you see a connection? No, you don't see a connection between the
I'm not sure. I've been told, I have a friend that's a doctor, and he has told me that, some of this may be, that all of this may be related. Like that. I'm also concerned too, I wonder that I was always a pretty athletic, active guy, and I'm to the point where I really have nothing physical left.
Well, let's take a minute just to go over some of the issues here. Your weight today was how much?
282 pounds.
282, and you're about how tall?
5'9".
Well, let's take a look at this chart here. And if you look at 5'9" here and across here to 282, this gives you the BMI, the mass body index. And what does that come out to?
Extreme obesity.
What number do you see there?
42.
And then in terms of your waist, do you have a waist?
44-inch waist. That's another thing that happened to doctors. I went into a clothing store to buy clothes, and to an Old Navy, and I was told that I had to go to a big, tall shop, but I could no longer buy clothes over the counter.
So the Institute of Health has some guidelines, and these are the guidelines here that talk about your BMI and also your waist, and you can see from there that there is some risk to health. So what are some of the things that you enjoy about what you've been eating?
Food. I love everything about it. I love everything. I love to eat. And also, I think it acts as a drug with me too. I tend to eat late at night, between 9 and 11 o'clock at night, and it puts me to sleep and relaxes me. And I eat when I'm stressed. I eat when I'm...
So you really enjoy the taste of food, and what it does for you, just like relaxes you,
I do.
And de-stresses you. Looking at the other side of things, are there things you like less about it?
Well, a lot of the things I already described, I think the effects it's having on me. I mean, even to the effect of, I almost have like a hangover in the morning when I eat enormous amounts of food at 11 o'clock at night. I wake up in the morning and feel like I have a hangover in my whole body.
So you have some concerns about, you mentioned before, your blood pressure, your health, your activities. Yeah. Are there any other things that you can think of?
Well, my appearance. I mean, I'm married, and I think I got to take into consideration what she's looking at every day. So in the worries that it's causing her and my family. My father was a physical fitness buff. He's in his 70s and very active. He's very concerned too. Right? He doesn't want to lose his son. He said that. Having been on the other side of the fence, I have been on the other side of the fence. I have been a healthy, athletic guy. I know what the exercise does to me. So if I get to the point where I'm capable of doing it, that's going to be the key to get myself to the point where I'm capable of doing it.
I see that. Have you made some changes before in your life?
I have. I've battled other addictions in my life. I quit smoking. Almost 5 years ago. Which added to the fact that I'm here. I think, because I've been about 50 pound. But I did quit, so I was a 2.5 pack a day smoker, and I quit smoking. And I got on some other demons, you know, many years ago, about 15 years ago, you know. So I mean, I've been down this Bobby Joyous road, and I say Bobby Joyous because there are both sides of the road.
It's pretty impressive that you were able to quit smoking. How did you accomplish that? Did anyone help you? Did they support you in it?
Yeah, you know, it's kind of like my mentor, my role model is my father, and he was instrumental in talking about that. And some of the other issues that I'm dealing with today, you know, some of the health issues that I'm dealing with today started to really be heavy in that area too. But I use Red Gum as a tool for 3 or 4 weeks. But I think I could have chewed a toothpick at that point and probably done the same thing, because when it came time, it was time.
It sounds like you've got some support. You've got everything in the past and support from your father. Certainly, I'll support you in any way I can today.
And starting to exercise, which is never fun when you look like I do, you know, and doing it the right way too, because I tend to have an obsessive personality, and that could.
What's that since you know? What did you come up with? Get yourself going. Because it sounds like once you get going, you keep going. Or we got to get you going.
I've been offered a membership at the YMCA, you know, at a very reasonable rate, because I negotiated one for the nonprofit. I'm the director of, when he offered me a membership for almost pennies. I think that's a great first step. I've been a member of the YMCA since I was 8 years old, so I've been a lifeguard for 40 years. You know. So that might be a good start for me. Just hanging around that environment is a pretty healthy environment.
So once you get going, and in addition to that, you said you were going to diet. This can start that going.
My feeling on that, I think a good number of us in society know how to eat. I think we all know how to eat. I don't think we need to put a fancy name on the diet. So I think if I just incorporate what I already know into that, and it sees a little bit of help maybe from the folks at the Y and some people that you know, maybe you.
Waiting, then I have very little motivation to do it. Right. If I see that I've got some time, and it actually looks like the schedule's fairly open, then yeah, it may be an 8 to a 10, depending on what I think, if the moment is there between me and this patient. I also work in a situation where I can identify the problem and divide it off. We have drug and alcohol counselors and various other mental health professionals that we can bring in. And that's probably a much better model for most active physicians. So I can identify a problem and actually have somebody seen at that time of the visit, which I think is much more realistic for our environment.
Have you ever been challenged in how to make the referral, whether to accept the referral? Because once you mentioned speaking to a specialist about their substance abuse, they may sort of push back. Because this method is about how to make a referral as well.
Right. No, there are certainly times when you do need to introduce the whole idea of a referral very gently, and you need to elicit the right motivation from the patient before you can consider taking that step. So, I can certainly see that. If you include that part of it in terms of, getting somebody to approach what their level of motivation is to accept a referral, then this is something we probably do in a very abbreviated form, very routinely.